A warm welcome to everyone. Thank you all for joining us for today's session. I am Dr. Ashutosh Acharya, working as an assistant professor in Lakshmi National College of Physical Education, Trivandrum, and I am the moderator for the day. And today, amongst us, we have an eminent speaker, Dr. George Matthews, sir, and he is an associate professor in Lakshmi National College of Physical Education, Trivandrum. Sir has 32 years of teaching experience, and he was also a faculty of most respected college, Christian Medical College, Vellore. And sir also has degree like MBBS, BPMR, BNB, and MPhil in clinical epidemiology. And sir also has attended higher training in sports medicine and biomechanics from United States of America. So, sir, on the behalf of the Sports Authority of India, on the behalf of the Ministry of Youth Affairs and Sports, and on my personal behalf, I feel really privileged to welcome you to this session. Thank you, sir.
Thank you, Doctor.
So, I mean, there is a few things which I would like to say. If you have any query or any questions during the presentation, please type them into the question box in your control panel, and I will note it down, and definitely we will also have time for questions at the end. So now, without further delay, I welcome Sir Dr. George Matthews to this to take over. Sir, please.
Thank you, moderator Dr. Ashutosh Acharya, for that very generous introduction. Dear participants, I am to speak to you on this topic of first aid and safety in sports. In fact, even if we are not intentionally doing something, safety is incorporated into all our routines. As professionals in physical education, your training has been programmed in such a way that safety is paramount. So when we continue in a profession, whether it be in a health service profession or in sports or physical education professions, safety cannot be sacrificed at any cost. It's the responsibility of every coach, every teacher, every doctor, nurse, physiotherapist, whoever is concerned with performance in sports, to take part or to involve them in activities which are considered safe and which will in no way jeopardize safety during the classes. So with this small introduction, let me share my screen with you. I'll share my PowerPoint on first aid and safety. So here we are with the first slide, which says safe environment and first aid. It's primarily to protect the participants, and I expect most of you are presume that most of you are teachers, and specifically in schools. So when a teacher in a school gets to handle classes for his students, they are really like foster parents for the day, because the parents will be at work or somebody will be at home. So they are actually entrusting you with the safety of their wards. Unlike other classes, which are basically theory classes or practicals in the laboratories, the physical intensity of participation is high in physical education periods. Therefore, the risks of injury or more serious consequences are very high in physical education period. So we cannot ignore this aspect. Safety should be programmed so very well into your routine, so that in no way will you forget to include a safety protocol. There can be no excuse like, see, I did not remember, I forgot, that was an oversight. No, this should not happen. So there has to be a proper protocol plan for every program. It's not only important that a student participates with utmost care and safety, it's also important that they participate in an environment that is conducive to safe participation in sports. So whether it is a safe playground or a safe classroom, it is part of the school's responsibility that a safe environment has been created for these students. A seemingly safe classroom can be poorly ventilated, stuffy, and the persons who return from the playfield will not find it comfortable sitting inside. And that way, the comfort is directly affected, or the discomfort is directly affecting the health of the students. So, physical education teachers must take it upon them to uh, remind the teachers, the school management, that they should be allowing proper ventilation in the classrooms, open windows, fans, whatever is required for that particular climate. So please do not ignore these students who return to their classrooms after the physical education periods and remain in a very stuffy environment. That will take away the fun and enjoyment out of these physical education classes. The thought of returning to the classrooms will really put them off, because if they're going to be sweaty and stuffy, they're sweaty and in a stuffy room, they are not going to be very happy about it. So when we look at child safety, it is different from safety of adults, because here they are not really decision makers legally. They may not be legally majors, which, as all of you know, is 18 years for us, for this country. But most injuries are minor. That is one uh, important point that I would like to highlight. Fortunately, we don't get very intense participation in sports in schools or during school periods. Most of the injuries are minor, but we must always be on the lookout or on the be alert against major injuries happening or complications happening after minor injuries. So there will be parents, will be teachers, and for very small children in the primary, pre-primary stage, there will be caretakers. All of us, or all teachers, would be having a role in ensuring the safety of the athlete. In some schools, there are school nurses, so they will put in additional contributions with their professional training in regarding not only first aid, but will also help in the proper management of injuries once they or illnesses in school. In child coming to school or participating in sports during school time could be having problems related to their safety during sports, or water safety if the school has a swimming pool, playground safety where they may be allowed to play without supervision, head injuries which lead to a condition known as concussion, or falls which can occur on the playground, in the classrooms, in the corridors, onto the furniture in the classrooms. Helmet safety is not very important. We don't allow that kind of sports sessions in schools. But if they are uh, using some kind of protective helmets as part of their game, then they must know how to handle it. But it is of minor importance. Bicycle safety, yes, still some students do prefer to cycle to school safely, but the roads are very congested and there is haywire traffic, which could probably adversely affect their safety. But let us concentrate on the safety issues within the school environment. See, whenever there a school is preparing or the students for some class or for some common physical activity or a mass physical activity or a participation in an event representing the school, the kids have to be prepared for the demands. The environmental condition, the ambient weather conditions must be taken into account. Most of the children are actually dressed up well. when they come to school with their neckties, which shut off their heat output from the body. So, in fact, we are allowing them to roast or bake within the shirt and tie that they wear to school, which is not meant for many of the environmental conditions that we find existing in India, unless it is the cold season. So, during the winter, the neckties and the closed collars are all right, but in summer or in countries, or sorry, in states where there is not so much of cold weather conditions, these kind of westernized uniform pattern will only worsen the misery of these students. They'll never enjoy the participation. Even if you allow them to change, most schools don't have a changing room for them to change to sportswear. If it is there, I think that's a big boon for the students. They can carry their uh, t-shirts or jerseys to school and then change in the rooms, in the changing rooms, and then come out to play. If that is possible, that should be allowed. And if the school is pretty big, there should be room for the students to change into sportswear. Physical activity wear is very important because heat transfer out from the body depends on the kind of fabric that you wear, plus the design, like whether it's an open collar, whether there is sufficient space around the neck or from the sleeves for the hot air to exit, whether the day is windy, whether there is hot sun. There are so many aspects that we take into account because heat can damage the normal physiological mechanism of the body. And once the body heats up, it starts getting fatigued and performance decreases to uh, very low levels. So warm up and stretch can never be overemphasized. The sports gear has to be appropriate. Rest, never compromise on rest. Without rest, no athlete will recover from an activity session. Even if it is a sedentary person who does nothing, he requires about 6 to 8 hours of sleep every night, because we, as an animal, we are programmed to have the recovery happening during sleep. And without sleep, our body will not recover for the next day's 24-hour process. So never compromise on rest, especially children. Children do grow when they are mostly sleeping. This is the time the body repairs its damaged cells. It grows, the hormones will be released so that the body grows into an adult size and shape. So never compromise, giving too much of homework, putting them on online classes, even after school time, or taking them to tuitions, and to that their training in sports plus their interest in music or arts, which will take them to other classes, will eat up a large chunk of their time that they are being awake. And that will be actually extended so that some more sessions can be included in that hectic schedule by the parents. So that means sleep is compromised, or they might be woken up very early so that the parents can also leave for work after getting the children ready for school. But never, from the school's perspective, never give too much load that will compromise the priority of rest for these growing children. And as coaches, we must always be prepared for the worst. And if we get to talk to a parent, be a supportive parent. Don't be a demanding parent. Don't compare one's child with another a child of another family. Each individual is different and unique. Now, preparing kids for the demands of playing a sport, there are so many things that you know. I will not elaborate on this slide. I would rather stress on the first aid part, which is to follow. And there is no point in my talking to you about this, because you should be able to tell me better about all these things. And the sports gear appropriately designed for each sport will always be available now in almost every part of the country. It is not a big issue at all. But in school, you can have compromises. You don't have to have the full safety kit, and you don't have to play with the standard versions of the ball or the bat. You need not have, for example, if you're playing cricket in school, allowing cricket to be played in school, you can have a much harmless ball being used rather than this potentially injurious cricket ball. It will not never take away the fun and the utility of allowing children to play during school hours. So keep the fun going, never compromise on safety, but still the students will enjoy. But whatever be the kind of ball, they will enjoy the socialization, the camaraderie, and the enjoyment that they have on the field, and uh, the skills that they learn to face life full steam ahead. How they face victory, how they handle failure in sports. This is important for them to be psychologically prepared for everything. But in this process, never ever sacrifice safety. Now, this is followed by what is concussion. So, this being one of the most important organs of the body, everybody must know what is concussion. See, how to define concussion? Concussion would be defined like this: it is a temporary dysfunction of the brain due to a head injury. Temporary. Most cases, it is temporary. It will not last more than a couple of weeks. In some, it will last only for a day. Dysfunction, yes, dysfunction. All the functions of the brain can be affected, and they malfunction, and it happens after a head injury. The brain is a very soft, pliable organ inside your skull. And even though the skull is very rigid, the brain is pretty soft because the skull is supposed to protect the brain. And the soft brain, in a fall like this in this picture, the soft brain can impinge or hit the rigid walls of the skull, the inner walls of the skull, and get a minute amount of crush or a minimal crush, which will affect the functioning of the brain of the affected areas, or in fact, the whole brain can be affected because this brain is being shaken like an egg inside its shell, and that will temporarily bring on swelling in the brain, and all functions will be damaged. And one of the most prominent symptoms of concussion that will persist for many days is headache. Headache indicates a damage that has produced some swelling in the brain, which has not completely disappeared. It takes time to resolve this problem. There are so many other issues described in this picture. I'll tell you some of them. The most important, the first we must look at the immediate symptoms. There is a person who collides with another person in football, and he falls down unconscious or not very conscious. And then the game is stopped. He receives medical attention. The first thing he asks on waking up is, "What has happened to me?" That means he has forgotten completely whatever incident that occurred that produced concussion in him. The impact, the collision with the other member is completely forgotten because the brain has shut down for some time, and he has lost that portion of his memory off immediately at the point of concussion to the point of waking up. He doesn't remember anything. That means his brain is having a concussion. So if an athlete has fainted on the field after an injury, recovers, opens his eyes, starts talking, he says, which is this place? Where am I? What has happened to me?" That means he is having a concussion. The brain has had a severe shake that has affected its function. There will be several other problems also, like he will not be completely disoriented. The disoriented means he will not know where he is. He will not sometimes even know what time of the day it is, whether it is morning or evening. He will not remember the date, month, or sometimes even the year he will forget. Of course, all this is temporary. Uh, he will, of course, remember his name. He'll remember old things, but he will not remember the new things or the recent things. His recent memory is gone. This is a sign of confusion in the produced by this concussion, this cannot be ignored. If you ignore concussion, you are asking for trouble. Concussion means the whole brain has been shaken inside this rigid shell, and the brain has temporarily shut down in some areas, and now it is slowly restarting. At the same time, the brain, because of its shake, starts to get swelling, and which will usually begin with a lot of headache. This headache will continue for 2 to 3 days, and this headache will should never ever be ignored. If you ignore headache and allow the person to participate in sport, because of the shake that happens during physical activities, there'll be more swelling, more headache, more serious complications. Depending on which parts of the brain are injured, across several symptoms that can come, like blurred vision, nausea. The person is feeling like vomiting. The person will dizzy, will be having imbalance while standing up. Sometimes we'll hear a ringing sound in the ears. The person cannot react well. Reaction time is slowed down. Lack of concentration. He will not be able to listen in class. He will not be having the basic mathematical abilities. He cannot calculate simple sums. So this is all showing concussion. But concussions, fortunately, are mostly temporary. There can be 3 degrees of concussion based on the severity. The more severe it is, the more serious could be the outcome of the thing. And in where some people, this concussion cannot be easily sorted out. They may require investigation, like a scanning of the head to make sure that the brain has not been injured. Knowing this, now you should always remember, head injury must be respected, never ignore it. And another point that I would stress here is the swelling in the brain can develop slowly over 24 hours. And so 24 hours is a very important time when there can be bleeding, when there can be swelling in the brain. There can be a shift of the person's condition from a minor injury to a serious complication developing, where the person has to be hospitalized or maybe even operated on to remove sometimes the blood bleeding in the brain. So there are symptoms which will affect the athlete, which the person who are taking care of the athlete or the roommates or the coach should be aware of. Number one is the person's consciousness decreasing. That means he drifts away into sleep or drifts away into periods of unconsciousness. He will be having nausea. He will sometimes have fits. He will complain of increasing headache. His vision becomes more blurred. He'll sometimes talk of double vision developing. I have told you, he'll develop fits, and all this is showing that serious things are happening in the brain. These persons should be rushed to hospital. Any worsening condition after a head injury should not be kept in the hospitals. These patients should be immediately shifted to the hospital. So concussions will take sometimes a turn for the worse, because then it may not be a minor concussion. It could be other problems like bleeding happening in the brain. So they need to be taken to hospital and admitted. So do never ever ignore head injuries. And that's why we do lots of things to prevent head injuries in all sports. Wherever there is a risk of head injury, we ask them to wear protective gear. The gear will protect the head from all these acceleration, deceleration forces, and then take away the risk for such injuries, damaging the brain permanently. So rest is a priority, because rest is the time for recovery. Rest is the time for body growth. And so these are, of course, known to you. There is not much of new thing that I can tell you at this point with this. Uh, so let us move on to the next slide. Now, importance of water. This can never again be overemphasized. Water cannot be ignored. We are in a tropical, subtropical area where there is a lot of need for water. Water is now actually considered as one of the important nutrients for the athlete. Even though it doesn't give any nutrition, it is important for all nutrient functions to happen within the body. And without water, the person will not only have a reduced performance, but also will go into serious complications related to his heat balance mechanisms. Dehydration should not happen. Dehydration usually is indicated by thirst, but all of you must remember that very minor degrees of dehydration, like a 1% dehydration uh, or 1.5% dehydration, will not produce thirst. And by the time thirst develops in an athlete or in a student, he's already 2% dehydrated, almost to 1.5 to 2% dehydrated. So there should be all these kind of policies which allow drinking to happen during the game. That's why we have intervals. We have drinks intervals in certain games. We have these mid-time interval. All this is meant to rehydrate themselves. And also, of course, they will be hydrating before they enter the field. These things should not be ignored. Encourage children to bring enough water. One of the greatest disadvantages of our Indian schools is that many schools do not have good, safe drinking water. So the absence of this potable water in the schools will force them to bring the water they require to school every day. That means if they bring a half a liter bottle, that will rarely be sufficient for them to participate or even sit in class without getting dehydrated. Suppose they bring 1 liter of water. That is going to add 1 kilogram to their bag, school bag. So unnecessarily taking a lot of water to school just to avoid drinking unsafe water, because the parents are concerned that the water in the school is unsafe. This will tremendously increase the load of the backpack of the school bags. So the school can take at least a very big step in providing good filtered UV sterilized water available, and they can bring their own water bottles which can be filled from these common uh, potable water points. And that will be a big service to the students because they can come with a lighter school bag and they'll be less tired when they come to school, and they can have enough of water uh, during activity or after activity or before activity, and also when they are in classrooms. When they are hydrated, they will function better, they will be more uh, alert in classes. The moment you are dehydrated, your alertness decreases, the body's ability to concentrate decreases, then you become very susceptible to heat disorders. You will find people who are very smart looking on going to the school in the morning, come back completely disheveled, shabbily dressed, tired, unable to participate in friendly matches at near their homes because they're completely zapped during the day's experience in school. So let us avoid that by making activities pretty comfortable, having enough water given to them, and also by having uh, shaded areas for them to play or rest. Playground safety, you are the experts. I will not linger on the slide any longer. So let us move on to this. Water safety. Water safety is very important in schools which are having swimming pools. Even a shallow swimming pool could be enough for a child to drown. So that should not be, having a shallow pool should not take away the responsibility from the school that we have only a shallow pool, so we are not keeping children, so adults for supervision. That can never be excused. No child will enter the swimming pool without an adult supervising. This should never, this kind of safe behavior near water or in the water should be actually emphasized, so that the students also will learn the importance of having somebody supervising them while they play or splash about in the pool, even if it is a very shallow pool and only around the waist of the child when the child stands on the swimming pool floor. So this water safety is important, but you don't need to have life jackets for a pool, but they should actually be supported. But there are, if we are going to start with these swimming classes, the beginners can have flotation devices uh, attached to the body so that they will not sink. But if they have a drowning accident, what should be done? It must be known to everybody, which will be handled in the coming slides. And the rules of the game should never be ignored. Rules are meant to be followed. because it's primarily framed to keep sports safe. And nobody should play when they are injured. Injury should be allowed to heal. And this is the most important area that I would like to talk to you about today: first aid and CPR. Now, everybody knows what first aid is, but I'm not going to. So I'm not going to explain what first aid is, but I'm going to tell you the basic rule of first aid. The basic rule of first aid is do no harm. Never ever do something that can be harmful to a casualty, a person who is afflicted. Which means that if you are not sure what you're going to do, don't do it. If you're not sure that your intervention would benefit the student, don't do it. Don't think that you know first aid. If you're not sure of what you're doing, leave it to aside and stand aside and let somebody who knows handle it. What is first aid? Everybody knows when it should be done, when first aid is required. That means for that aid is the only aid available. That means the person is not in a hospital, the person is not with a medical team, and sometimes the medical team without all the gadgets or medicines can only do first aid. So whatever best possible in that situation is called first aid. And that means anybody should be able to do it if properly trained. And first aid should be done by the person who knows the maximum in that group. So there could be 5 people standing around, each having different levels of first aid training. So don't jump in and be over enthusiastic if you are not fully trained. Let the best trained person do the first aid, and the other persons can assist. So first aid is not the place to show off your skills. First aid is a life-saving process in most cases, and if done properly, can save lives and reduce morbidity, reduce the consequences of injuries. So never do harm. Do what you can do only if you are being trained to do that, and if you're aware of what to do. And also, the third thing I would like to stress: never do things which you don't know. You can rather leave them alone instead of doing wrong things. You unnecessarily trying to interfere or intervene with the first aid can sometimes damage the person very significantly. And whenever you have the requirement or the incident happening, you must, most important thing is to recognize what has happened and then identify the hazards. Hazards can be to the athlete, injured athlete, or hazards can be to the first aider, that is you. That is why we are talking about safety of self. Then it should be in accordance with international first aid procedures. There is only one procedure for first aid. All others are wrong. And then you must know how to do a CPR. So to assessing the incident and determining what is to be done and how to do it, taking care of one's safety and of the others. For example, if the person has fallen near a pool or any deep water body, the person has a hazard of the drowning hazards looming nearby. So the casualty must be shifted away from this potential hazard. So that is the duty of the first aider. Or if the person has an electrocution and is very close to an electric outlet which could probably produce electrocution, again this person has to be shifted safely away. Or from a fire nearby, that means the person has to be shifted away. So all sorts of hazards. So we have to look around the casualty also. It's not just the casualty that requires our attention. The person plus his environment must be scanned and a decision must be taken to protect them, and then protect yourself. Nobody in no person with sound mind would uh, endanger himself or herself and do first aid, because if you try to save a life by endangering yourself, you will probably end up by sacrificing your life also. So if you are not sure about your safety, you can never help a person. So be confident of doing things and first make sure that you are safe. uh, don't For example, a very simple example, or a very plain example of how people disregard the safety. Suppose there is a bleeding happening on the field, they don't take adequate care to allow to prevent blood from being from touching their skin or falling on their any of the body parts. There can be blood-borne infections that can be transmitted to the first aider, so let us be very careful. Now, the next first aid for musculoskeletal injuries is very simple, which is this is a very useful process, and it is a very important process in the rehabilitation of the athlete. Rest, ice, compression, and elevation, commonly known by the acronym RICE, or sometimes called RICE. It is RICE: rest, ice, compression, and elevation. Rest for the injured area, ice for the injured area, that will reduce bleeding, it will reduce swelling, it will reduce pain. And compression, especially by using a bandage. The bandage can produce compression, and that compression will reduce swelling formation and also provide support to the injured area. And elevation, because the swelling will increase when it is that body part is hanging down. For example, the ankle joint is sprained, the swelling will increase if it is hanging down. So if you elevate it, either keep it straight, or when lying down, keep a pillow under the foot and ankle. That swelling will not collect around the ankle and it will flow away, thereby reducing the swelling and thereby speeding up the rehabilitation process. So this has to be followed everywhere. But what I would like to give you only one tip here. Ice cannot be applied directly onto the skin if you are going to keep it stationary over a point, because ice will lower the temperature of that area of skin very quickly and produce what is known as an ice burn. Ice burn can be damaging to the skin, and the skin will completely peel off or slough out in by the next 2-3 days. This should be avoided at all costs. The most important part of first aid is cardiopulmonary resuscitation. Cardio means heart, pulmonary means lungs, resuscitation means restarting, bring back to life. So it's obvious. It's implied in the name of the procedure that the heart and lungs have stopped functioning, or the heart and breathing has stopped, and they are being restarted, or they're being restored to the person to keep him alive. So, which simply means that if the person's heart is beating, he doesn't require CPR. Never ever try to give CPR on a person who is already having heartbeat and respiration, and never give it to a person who is conscious. It is a very painful condition, painful procedure. And also sometimes it can break the ribs when you're trying to revive a person who is almost dead. And by this, some people have saved people's lives, but broken their ribs. But that can never, they will never be punished. The first aider will not be punished for fracturing the ribs of a person who has been revived and saved by a first aider, because the pressing down on the heart is so hard and deep to compress the heart. It will also compress the ribs. You cannot help it. And in some people, the ribs can fracture. So that is why you must never practice on a living person. You never should do it unless you're sure that the heart is not beating and the person is unconscious. So what do you do for a CPR? First one is to make sure that the person is unconscious. So check for a response. If the person is fast, just fainted, he'll wake up when you call him. You can call him or her by his name, and then you can tap on his shoulders. Tap on his shoulders hard like this without shaking his body to wake him up. You can even slap on his shoulders. That will wake him or her up. And if he has woken up, that means he's got a heartbeat. He doesn't require CPR. Then before you check going for the CPR, you have to open the airway by lifting the chin and pushing down on the forehead so that the head is actually tilted slightly backwards so that this airway is opened. Excuse me. This airway is opened. Airway here means the path from the nose to the back of the throat into the trachea and through the lungs. If it is bent forward like this, it will be closed here. And when you lift your chin up and tilt your head back, it will be open up here. And when after opening up the airway, you have to check for breathing. When you check for breathing, you can use your 3 senses that you're having. You can use your hearing, you can use your vision, and you can use the sense of touch. Here, when you look at the chest, you're using your vision to see breathing movements. Your ear is close to the mouth and nose. You can hear any breathing sounds. And also, any air that comes out of the nose will hit the cheek. And it's a very sensitive area. The cheek is a very sensitive area which will sense the air current that coming out of the nose. And so with one position of the body, this lady will ascertain that this person is not having a breath. So no breathing seen, no air current here, and nothing heard. That means she surmises that this person is not breathing, and he gives an artificial breath, 2 artificial breaths known as recovery breaths, each of 1 second duration, by pinching the nostril, opening your mouth, sealing the mouth around the lips of the casualty, and then blowing hard through the mouth for about 1 second into the mouth of the athlete, and from there it will enter the lungs. This process must be done only on persons whom you know. Never do it on strangers. You don't know why this patient has collapsed. You don't know whether the person is having a disease which you can get like this. So there are gadgets which are available in hospitals which will be connected, and artificial breathing given in other means, not like this. Now, chest compressions, how to give. Before you give chest compressions, you have to check the carotid pulse. Carotid pulse is checked on the side of the neck like this. You can check on one side, never check both sides together, only check on one side. And you find that if the carotid pulse is not felt, you can give the chest compression. Keep kneel on one side, keep one hand on the center of the chest, use the other hand to lock and give a concerted effort from both hands, lock the elbows and push down with the whole upper body so that the chest is compressed to a depth of about 4 to 5 centimeters at the rate of 100 compressions per minute. That means faster than your normal heartbeat. And after every 30 compressions, you have to stop and give 2 rescue breaths. So the ratio is 30 chest compressions to 2 rescue breaths. So 2 rescue breaths will be followed by 30 compressions to keep the heart pumping. That is how you try to restart the heart, and this will happen. This process will be continued till a resuscitation team or an ambulance crew arrives, or some expert help arrives. Now, for a person who's got a heartbeat and who is breathing, who doesn't require any CPR, he has to be put onto the side if he is unconscious. Otherwise, when he'll vomit, all the vomiters will pass into his lungs and produce serious problems. So to prevent that, put him on his side, and this position is known as the recovery position. When you put on your side, when you put the athlete on the side, his saliva or vomiters which comes from his stomach will only flow out. It will not flow back into his lungs. So this is a position for any person who has fainted or who has fallen on the field but is breathing and has got a heartbeat. Sometimes after a long race, you'll find people collapsing on the field after the finish line. Put them in the recovery position, allow them to recover. Now, for near drowning, of course, when you talk about water safety, you must always be prepared for handling near drowning. For near drowning, this is the correct first aid. If there is no breathing or there is no respiration, or the presence of the heartbeats, give a CPR and shift to the hospital. But if the person is breathing and his pulse can be felt, There is no need for CPR. Put the person in the recovery position and shift to a hospital. So CPR is required when the heart and lungs are not working. Whereas if the breathing and heartbeats are present, you can take the person, keep the person in the recovery position. Now, this is another condition where most people seeing this or witnessing these things will get will panic, will be afraid seeing somebody having fits. If the person is having fits, it's very simple. Don't try to stop the fits from happening. You cannot stop it. Don't put any metal into his mouth. Don't put any metal key in his hands. Don't try to hold him down. Let the fits continue, but put him in the recovery position. That is all that you have to do. The fits will, once it starts, the fits will continue for 2-3 minutes and stop. And that is the time when the person will be unconscious. He will not be having any idea what is happening. Put him in the recovery position and allow him to become conscious. The fits will stop and the person will become unconscious. But if the recovery is not happening, that means if the fits are not stopping, it is a medical emergency which has to be handled in a hospital. There have to be medicines given to control his fits. So the fits continue for more than 3-4 minutes should not be a reason for allowing the person to be in a recovery position. He can be in the recovery position in the ambulance or in the car. The person has to reach a hospital. So when you find an unconscious athlete, please remember, don't just turn him over to examine him. When you find an unconscious athlete, let's say the person is lying on his face, I can't even see his face, somebody is lying on the ground unconscious. First thing you have to do is check his pulse, that is the airway, breathing and circulation in the position that you find. And when, if you think he requires CPR, you can safely or carefully turn him over. You can control the bleeding by 3 methods. The third method is not included here because it is done usually for very severe wounds like in the war wounds. The two methods are very simple: direct pressure, which most of us follow. Also, here you have to remember not to contaminate your body with the blood of the other person. Your hands and fingers should be either protected by gloves or you use a cloth, some cloth, to apply pressure, or you can elevate the affected arm also to keep the circulation less in that area to reduce bleeding. Now, first aid for bleeding nose, this again is wrongly performed by many people. The process is very simple. Don't let the person lie down. The person has to sit and lean forward. Sit on a chair, lean forward, keeping the nostrils pinched so that the bleeding area is pressed. So if you pinch your nostrils, if the athlete pinches his nostrils, how does he breathe? He has to breathe through the mouth. That means the mouth is kept open, the nostrils are pinched, and he leans forward, remains like that for 5 to 10 minutes. This will stop almost 90-95% of bleeds. But if it continues, you can try another session of 5 minutes, and it's still persisting. The person has to be seen in a hospital because the bleeding is not a minor one. It has to be something has to be done to stop the bleeding point from bleeding. So the person goes to the hospital, also is sitting in a car or ambulance in the same position, sitting by leaning forward, keeping the nostrils pinched and keeping the mouth open for breathing. Now the role of coach and parent, everybody knows. You have to be careful who has not to exceed your brief. You have to be a very protective coach. Don't be a very tough taskmaster extracting performance from school students. No. Physical education classes in schools are meant to get their motor development proper, get their psychological development appropriate, and their social involvement most desirable. If these things are achieved by physical education classes, your teacher's job is done. Excelling in sport or coming up the ladder in sports achievement is not the primary goal of sports and physical education in schools. You are here to develop them as good citizens, to get their personality and their social behavior and their motor skills appropriate. So you are a teacher, we have to concentrate on this teaching. And now I'll give you some examples how first aid may not be properly arranged even in this 21st century. There's an incident which happened in Kerala. A boy was helping out as a volunteer in just a few seconds. It is not on. Battery is low. I think it's on now. I'll stop sharing a few seconds. I'll come back to you. Yeah, now it is connected. Yeah. Battery settings. So I'll share my screen again. So here we are. This boy got struck by a hammer on his head while he was volunteering at a very important meet in Kerala. And here is the boy lying fallen. You can see his, you cannot even see his face. Assessment has to be done in the position itself. But let's look at the picture I'm going to show you next. This is the way the boy was shifted out from the stadium. Just happened last year. Do you think this is the best first aid that the boy could have got that day? A serious head injury, you can see his head is bleeding, he's unconscious, and they are actually trying to help, but is this help harming him? You must know that when a person gets hit by a heavy thing on his head, it's not only the head that gets damaged, he could have injured his neck also or his back. And when you take him up, scoop him up like this position is not good for his back or neck. This team could have just worsened his injuries to the back. This is pretty unfortunate. This should never happen. First of all, this boy should not have been asked to volunteer. He was just a school kid who just was interested in watching the game, and he was asked to volunteer. So it's an organizational fault. Second, there was a fault in the way first aid was given, because there was no first aider, no ambulance, no stretchers, and a serious injury handled like this, and very unfortunate because the boy lost his life. This should never happen. Whenever you plan an event, think of any sort of consequences. This is not a very small meet. It was a state level meet, and there should have been adequate precautions for the first aid. When you carry a unconscious person like this, you're asking for trouble. The trouble is for the person. The person should only be shifted on a stretcher or on something known as a spine board. By keeping the body straight without bending like this will produce more injuries to his back or neck. Any sort of injury can occur in any level of competition. Here is a broken leg here. If this occurs, what happens? You can see this photograph has captured the rare moment of the bone actually fracturing. You can see the leg bone fractured and at an angle here. See what will be happening here. You'll find in these events, there will immediately a team coming up and then shifting him in an ambulance to the hospital. This kind of arrangement has to be made. Only then you will be having the appropriate first aid available to them. Here there is no first aid that you can do to put the knee, the leg straight. You can splint it, of course, but if that's only when you don't have any other facility available. But in a competition like this, there will be an ambulance team who will shift them to hospital, shift the person to hospital and provide adequate care. Weightlifting even like this. See, look at this. The danger of this kind of injury is, number one, the elbow has been dislocated. And secondly, because his elbow is out of control, he has actually is dropping the weight. And that will produce a second injury to his back or neck. Very dangerous situation. And here you won't find spotters. So here you are actually in a very difficult predilection, because your predicament is pretty difficult here. Why? How do you actually prevent it? Very difficult. But once it occurs, you should be able to handle all these injuries. Never pick up these people and run away to the ambulance. They should be shifted slowly, properly, without disturbing the injured area of the back or the elbow. So don't be over enthusiastic and try to help out without following proper procedure. See, again, a bad organizational aspect is a javelin in an international competition which strayed away and hit a long jumper. You can see it's penetrating the chest. Luckily, this player survived. This should not happen. Even if you think about the sector is safe, you have to take into account of all stray javelins or such sharp things, hammer, this shot, injuring other players or officials. This is a school event. This is a bamboo javelin, very rarely being used. It's still some schools use it. See, unfortunately, this boy had this javelin impact onto his head. It penetrated his skull and the brain, and his body, one side was permanently paralyzed. How sad. A boy who came to witness this annual sports day returns home as a cripple. This never should happen. Don't ever compromise on safety. When you forget safety, you are actually looking out for accidents to happen. Nobody will support you, or nobody will excuse you for any such, God forbid, such events occurring. It should never happen. How can you ever bring him back to the original state? So, see, people may not actually believe that a javelin can penetrate the skull like this. This reminds us of the olden times of gladiatorial fights where people used to poke through body parts like this. It's happening again 21st century in India. Please, for God's sake, let this not happen to anybody else. Then, of course, there are unpredictable injuries like, of course, the foul, the very famous or infamous photograph of this ear being bitten away. These things, first aid, of course, is appropriately given, but then the referee can intervene before many events, the adverse events occur. And sometimes, like in gymnastics, it's unpredictable. That I agree. The landing may not be appropriate. And here again, nobody should rush in and try to straighten the leg or lift the person by his hands and take him away. No, he has to be shifted out in a stretcher properly. Don't try to do things when there is other professional help available. Getting kicked in the chest or on the face is a serious injury. Of course, the referee should be very careful here in football, and that's why you know how these red cards are coming up so often in these international competitions. See, look at this. This is supposed to protect the gum. This is the gum protector in boxing. The punch has actually projected out the thing, and now this is going to get injured. So here, the fit of the gum protector is very important. I wonder whether he used the appropriate size, but this gum protector has to be customized and made for that oneself. And so these things, minor things, should not be ignored. And so to summarize, you have to know about the sports, about the surroundings, and about the ambient weather conditions. and you have to prepare the children in terms of this clothing that they wear, about hydration, and of course, basic warm up and stretch. Appropriate gear of protective gear to be used, rules to be respected. Everybody should be aware of the fact, and enough time to rest at home, and your first aid skills to be actually certified. So I would advise all of you to get first aid certification. First aid and CPR certification come together, and in all states, in most districts, there are Indian Red Cross uh, branches. Please approach them. They run first aid CPR courses. They give a certificate which is valid internationally and valued internationally too. So get yourself certified. Once you're certified, your skills, number one, will be tested and then certified. Secondly, you are safe legally to perform first aid. So thank you very much. Thank you for your precious time listening to my lecture. Now back to the moderator, Dr. Ashutosh.
Thank you so much, sir. This presentation of yours, I'm sure that your presentation will definitely help our participants to become a better physical education teacher by taking care of the injuries and those injury management aspect of the students in their schools or in the institutions where they are working. Yeah, one thing, sir, I would like to see one thing. Many of our participants actually they want this class to be taken or something has to be taught in Hindi. कुछ लोग डिमांड कर रहे हैं कि उनका जो क्लास है वो हिंदी में होना चाहिए और हिंदी में एक्सप्रेस करना चाहिए. बट आई वुड लाइक टू से दैट इफ अगर आपको कोई चीज समझ में नहीं आया हो, अगर कोई स्लाइड है कुछ समझ में नहीं आया हो, इफ यू कैन जस्ट पुट इट अप, यू कैन जस्ट आस्क क्वेश्चंस, देन डेफिनेटली आई विल sir is here, he will respond to your queries, and if it is required I will translate the queries in Hindi. So sir, so far sir we don't have any questions.
There are some questions, I think, on the chat box, in the chat box. That is not for this, it's regarding the evening session for this class. No questions yet, you're right.
Yeah. Sir, we'll just wait for a minute, sir. Like if any queries or if anything is there, then we'll just take it up. Participants, if there is any query or if there is anything, you can just ask. We will try to respond. Sir is here. Sir, one question has come up. What is CPR? Sir, Dr. Mukesh Kumar is asking, what is CPR?
Okay, probably you did not notice in the slide. CPR is the procedure for reviving a person who has fallen unconscious without without heartbeats, or not breathing. That means in a few minutes the person is going to be dead. His heart has stopped beating and he has stopped breathing, and soon he can be dead. So you are going to bring back to life this person by your attempts at restarting the heart. In many cases, you can do this CPR and bring back the person to life. So CPR is the short form of cardiopulmonary resuscitation. The heart here is cardio, pulmonary means breathing. So we have to, the heart's job is to pump. So instead you press down and pump manually from outside, so that the heart will get more blood and it will recover. And second, pulmonary, the lungs' job is to take in the air and which will be absorbed by the blood. Because the person is not breathing, air will not enter. So you blow through the mouth into the lungs. So this is called as cardiopulmonary resuscitation.
Actually, sir, I would like to speak. I mean, I would like to translate whatever you said in Hindi. I'll just try to translate it. So, सर का एक्चुअली कहने का ये मतलब था, जो CPR है उसको हम बोलते हैं कार्डियोपल्मोनरी रेसिसिटेशन, और इसका बेसिक काम होता है कि जब कोई किसी भी कारण के वजह से जब हमारा टेम्पररीली शट डाउन हो जाता है, जो हार्ट का है वो मतलब उसको एक इंसान अनकॉन्शियस हो जाता है, तो तभी क्या करते हैं हम इसको कार्डियोपल्मोनरी रेसिसिटेशन, ये एक टेक्निक है जिसको हम यूज करते हैं टू टू हमारा जो हार्ट को एक जो जिसको इंजरी हुआ है या तो जो अनकॉन्शियस है जिसका उसको हम रिवाइव करने के लिए कोशिश करते हैं, जिसमें कि हम एक टेक्निक यूज करते हैं जिसके हमारे थ्रू माउथ हो गया, थ्रू नोज हो गया, उनके लंग्स में एयर ब्लो करते हैं, और एट द सेम टाइम हम उनको उनके चेस्ट के ऊपर कुछ प्रेशर देके कुछ प्रेशर यूज करके उसको हम जो हार्ट है या तो जो लंग्स है उसको हम रीस्टार्ट करके, हमारा जो सिस्टम है उसको रीस्टार्ट करके उस बंदे को हम या जो भी इंजर्ड स्टूडेंट है उसको हम रिवाइव कर सकते हैं। So if there is anything else, you can take up. Sir, who will be responsible if any student is injuries is harmful for his life, sir? Sir, one question from Manoj Kumar Hembram. He is asking.
Look, Manoj Kumar, or to all the participants, I would like to again say that, see, your responsibility lies within your abilities, right? Your first responsibility is to keep the game safe, and that cannot be handed over or delegated to another person. To keep the environment safe, to keep the class arrangement safe is your prime responsibility. So whether you have taken into account of the hazards and taken steps to prevent hazards or remove the hazards is your responsibility, and you can be answerable to that. But if an injury occurs, in spite of taking all safety precautions, that is not your fault. Suppose there is something that is, for example, I will say something that is a sharp post that can be potentially damaging, or part of some net that is cut and the iron piece is projecting, and the boy rams into that and gets serious injury. That is your fault, because you should not have allowed allowed a game happening there where there is a hazard very, very prominently in the playing area. So the situation which led to the injury is always evaluated. That is what we call as the pre-event situation. Before the injury occurred, could you have prevented it? If you could have prevented it, then it is your fault that you didn't do it. Second, the event. If you have not been careful, you left them unsupervised, and then the students had some amount of horseplay, they're fooling around, and a serious injury occurred, then it's a responsibility of having left your post at the playground and gone for some personal work. But if it occurred, if you are there and you've done all that is possible to prevent injuries, and if it has occurred, a serious injury is not your fault. Then the third thing occurs after the injury. What did you do? Did you do wrong first aid? Did you shift the person to hospital? Did you try to unnecessarily delay the shift to hospital? So that is important. So how we have prepared the situation, the game situation, how we have supervised it, and how we have responded after the injury. These things will be taken into account before somebody fixes responsibility and tries to take disciplinary action. So please do your job, and you get yourself certified in CPR and first aid from the Red Cross.
Thank you, sir. So as this, sir, we have got another question from Adnan Reza. He's asking, may I take protein, fiber, I mean PVMF as breakfast?
Sorry, what is PVMF? I don't understand.
Sir, he means protein, vitamin, mineral, and fiber. Just
okay.
in short form.
Breakfast. Okay, breakfast. I hope breakfast is something that is on a game day, or is it a general day's breakfast? You mean? I don't know. If let's talk about a game situation. Game day protein during breakfast is not good, and neither is fat. It will delay the digestion process, and so the person will have a full stomach and will not be able to play well. these vitamins and minerals are such tiny amounts found in food. You don't have to actually take it extra. It will be part of the food that you eat. If you eat a normal kind of food, the balanced food, instead of eating all the prepared uh, foods, what I mean, you are going to eat cornflakes and all that thing. These are not natural. Of course, they are fortified with vitamins and minerals. Eat your natural food, what is available locally. You'll get all vitamins and minerals. But you can take your proteins and fat after the game or during dinner. But the early morning pre-game meal, protein and fat is not good. And don't eat a heavy breakfast, less than 1,000 calories.
Sir, we don't have any more questions. So, sir, um,
So I think back to Dr. Ashutosh. Yeah, I'm done.
sir, there are actually 2, 3 more questions. Can we take up one more, sir?
Yeah, please.
Sir, there is one question. Uh, Sir, sudden cardiac arrest to myself, and I don't have any support that time. Then what can I do?
See, cardiac arrest means the heart stopping, and the person having a cardiac arrest will never realize that is he or she has got a cardiac arrest. He or she will know nothing. That means you just faint, collapse uh, within few seconds, 1 or 2 seconds, maximum 5 seconds, you will be unconscious. You won't even know it has stopped. And the unconsciousness process is not slow. You just suddenly drop to the floor. That means you will never able to realize that you have got a cardiac arrest, and only the person standing beside you will know. So that means the answer is very simple. Nobody who's got a cardiac arrest will be able to call for help.
Thank you, sir. Now we have come to the end of this session. Uh, I consider it as my proud privilege to thank our speaker of the day, Dr. George Matthews, sir. Sir, we are really thankful to you for having sparing some time for us in spite of your busy schedule. And on the behalf of the Sports Authority of India and Khelo India Ministry of Youth Affairs and Sports, and on behalf of all the participants present here, I consider it as my proud privilege to thank you for your presence in this program. Then, last but not the least, I also would like to thank all the participants that are present here with us for this program. Thank you so much for attending, and have a great day. Have a nice day ahead. Thank you so much. Thank you once again.
Thank you.